Doctalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to Doctalk. Today we're going to have a show talking about what we do with those heifers when they get to the feed yard and they're bred. It's something that nobody wants to deal with, but we need to. Stay tuned to Doctalk and we'll talk more about bred heifers in the feed yard after these messages.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome to Doctalk. I'm Dr. Dan Thompson and I'm very glad you joined us today. And today we're going to talk about something that I deal with in feed yards. I'm a feed yard veterinarian, spend a lot of time dealing with heifers and steers and different genders coming into the feedlot, and every animal brings a different opportunity and also a different issue. And with our production animal consultation, PAC is the name of our veterinary group, we cover about 25 to 30% of the fed cattle in the U.S. With a lot of great veterinarians. So one of the things that we deal with heifers coming in the feed yard is those that are bred. And what we do with heifers, especially from different types of backgrounds, is we will do a palpation or ultrasound those heifers or blood test to determine pregnancy status. And at this point in time, based on now this isn't hard data, but roughly speaking, 20% of heifers entering the feed yards today are bred, which is a higher number than what most people would probably guess. And of those 20%, 10% of those are what we call long bred, or further than 5 months gestation, meaning they're probably going to deliver that calf while they're at the cattle feeding facility. And so 2% or 20% are bred, 2% are long bred, and it creates challenges, right? Because these heifers are usually not something we selected for breeding. They're usually lighter weight, and we're going to push them on feed, which causes some other complications. And we don't have heifer calving much in feed yards. And so having that understanding of that this is very much an animal welfare issue, that a lot of times if we don't take care of number one, we'd love to have guaranteed open heifers coming into the yards. And if we have guaranteed open heifers, that removes a lot of things we have to do from upfront pregnancy determination. And then once we have the pregnancy determination, making sure follow-ups that we do have these heifers abort, because it's not something that we want to have happen of them having a term calf as they're being pushed on feed and as they're. So other things that it can cause, besides death of the heifer from an agonal death from trying to deliver that fetus, will have decreased performance. And if you look at the economics of heifers that are bred, that are open at arrival versus bred and aborted versus allowed to maintain their pregnancy, there's a huge difference in average daily gain and break even and feed conversion, because those heifers, while they may gain a lot of weight or look like they've gained a lot of body weight, all that energy is going towards a gravid uterus and towards growing that fetus the last 3 months of gestation, which we've talked about here on the show. So pregnant heifers coming into the feed yard cause a lot of issues. They cause disruption in our day and our ability to get things done, and take up time and labor and people's time. They have poorer performance, and they're a welfare issue from the standpoint of a lot of times when we have these heifers and they need a cesarean section, the case fatality rate on those is about 50%. If you have to do a C-section on a feeder heifer, and then just the pulling the calves, the fetotomies, and then the ultimate sacrifice of having the heifer increase our death loss. That's a lot of why of what the problem is. We'll talk about what we do about it after these messages.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
We know how expensive it is to keep and maintain heifers. What is also the fallout of those heifers if they're not the correct ones you're keeping and maintaining? We want to do as much as we can to get it right before we spend the money to impact our herd further down that road and keep successive females out of the wrong type of females.
Identity Beef. Contact your Neogen territory manager to test today.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
Valley Vet Supply sees the hard work and effort of you and your animals to achieve your goal of being a champion. And we're here to help along the way. To the cowboys and cowgirls, to the dreamers, we see you.
Hey folks, welcome to Doctalk. I'm Dr. Dan Thompson, and I'm glad you joined us. And we're talking about something that happens as mismanagement of heifers prior to arrival to the feed yard. Whether we leave the bulls out all year round, or if we wean calves and have yearlings and different things going on where these heifers are allowed to go through puberty and be exposed to post-pubertal bulls and get bred, and then we sell them as feeder heifers. It's just something that there's a lot of guaranteed open heifer sales, and I really recommend that we get back to some of those practices that we used to have. But inevitably, some of this, pregnant heifers is a reality. Again, 20% of heifers that arrive at the feed yard are bred. And so we have to do something about it. And when we do the pregnancy status, and so one of the things that's really important at the feed yard is to be able to age the fetus when we do the palpation or ultrasound. And based on the palpation or ultrasound, that then gives us an understanding of the regimen that we're going to use to abort that fetus, okay? And so let's just define first what we would call a shortbred heifer versus a longbred heifer. And the shortbred heifer is one that is less than 4 to 5 months gestation. And that means at that point in time that all of our progesterone that is being produced to maintain pregnancy at that point in time is coming from the corpus luteum on the ovary, okay? And so that first 5 months, the CL is producing the progesterone saying, hey, we're pregnant, and it's maintaining that pregnancy, and the calf and the fetus is there. Once we go over that 4 or 5 months gestation, that's when we start to consider this or call these animals what we would call longbred. And the reason why we have a difference in long-bred versus short-bred is that a long-bred heifer now is producing progesterone not only from the CL on the ovary to maintain the pregnancy, but also she is producing progesterone from the placenta. And if the CL would be knocked off the ovary, the progesterone being produced by the placenta from that point forward, that 5 months gestation until parturition, is going to be enough to maintain the pregnancy. So why is that important? Well, if we're shortbred, we can give them a shot of a prostaglandin F2 alpha or Lutelyse or whatever the product, generic product of Lutelyse or prostaglandin is available. And that 5 cc's of that product will knock out the CL, no progesterone, and the heifer abort. However, if the placenta is producing the progesterone after 5 months pregnancy, now we're going to have to give them another additional product called dexamethasone. So if they're long-bred, we're going to give them 2 shots. We'll give them the 5 cc's of the prostaglandin F2 alpha, which is going to knock the CL off the ovary, remove that progesterone, and then we're going to stimulate the stress response, fetal stress response, of giving those animals a shot of dexamethasone. Dexamethasone is the same as cortisone or cortisol, okay? The reason why we have heifers or cows give, they say, well, a storm's coming in, and I suppose they're all going to calve tonight. Well, the reason why they do is because when the fetus gets big and it's time to come out, it gives off cortisol. And cortisol then triggers parturition. And so when we get a storm, we get a trigger in cortisol. When we get a big fetus and it's time to expel naturally, we get an increase in cortisol. If they get stressed because of not having feed, they express cortisol. So what we do is we give 10 cc's of dexamethasone with the prostaglandin F2 alpha, which simulates time for parturition, and then we abort those long-bred heifers. So short-bred, just prostaglandin F2 alpha. Longer bred, we're going to give them 2 shots, prostaglandin F2 alpha and dexamethasone. When we come back, we'll talk a little more about managing bred heifers in the feed yard.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
DNA Dialogue is brought to you by Igenity Beef, powered by Neogen.
When we have samples that fail when they come through the lab, there's a lot of common themes that arise. I would always tell people, if you're sampling at birth, to make sure that that calf is completely dry, because one of the biggest things that cause contamination is when the placental DNA from the dam is still left on that calf. So that when you take the TSU sample, you're actually capturing not only that calf's DNA, but the dam itself. And a lot of times that could lead to a failed sample. Another key to success when you're taking a sample on an older female is to avoid punching through the tattoo ink that may already be there from her bangs vaccination. And lastly, TSUs can be stored at room temperature for up to 12 months. One thing that we like to avoid, though, is once you take those samples, make sure that you don't just throw them on the dash of the pickup truck, because the sun beating down on them and things like that can degrade the DNA. If you're storing them for longer than 12 months, we do recommend that you store them in a freezer, but not necessarily the freezer in your kitchen. We like for them to be in a deep freeze, say in the garage or out in the shop, because that way it doesn't have that auto frost and thaw that could also lead to the degradation of the DNA.
I feel the use of genomics for cattle producers will be more widespread than we're seeing it now. I think we're just in the beginning stages of it. I think a lot of people just see the side of the replacement females and increasing the predictability and future use of your females, because we all know the cost that it takes to develop those into a cow. The large side of it that folks miss out on is the use of genomics to predict the product that they're making every year, and in that I mean their calves. The feed yards are constantly after a more predictable product, a more predictable days on feed, a more predictable outcome on the rail. Through genomics, we're able to accomplish a lot faster what used to take multiple generations.
Identity beef. Contact your Neogen territory manager to test today.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name wherever animal health supplies are sold.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to Doctalk. I'm Dr. Dan Thompson. I'm glad you joined us. We're talking about bred heifers. I'm a veterinarian, a consulting veterinarian. I have a split appointment. It's kind of cool. I'm a veterinarian with production animal consultation and have feedlot clients, and I also have a 50% appointment at Iowa State University where I get to work with grad students and faculty members. But when we have bred heifers in the feed yard, we really have four options. Okay, one, you can buy guaranteed open heifers or spayed heifers. Okay, two, we can do nothing. Three, we can preg check and abort, or number four, we can do a mass abort the pen. If we're going to do nothing, you better buy a calf jack because we're going to have calvers and we're going to have difficulties. And so I really recommend at the minimum preg check and abort. Now, if these heifers are really small when you buy them, number one, they probably didn't hit puberty, but number two, it's really hard to preg those heifers because they're so small. But one of the things, the strategies we'll do if we haven't preg checked and we start to have heifers that bag up or they start to spring, is don't have your pen riders go through the pen looking for calvers when they're supposed to be focused on BRD. If we're going to do anything in pens that we didn't do anything, we're going to go back to those pens after we've gotten done, because our number one priority is riding our pens for BRD, for lameness, and for illness. And if we get distracted during the day of looking for piggy heifers, that's a problem. But when we start to have those pens that we're having one or two calvers come out of, we then want to ride through those and look for those that are piggy or bigger looking, maybe bagging down, and bring them up to the hospital where we can at least observe them and have a set of eyes on them on a more routine basis. But doing nothing can cause some issues. Now, the other option is to preg check and abort. And when we preg check and abort, we talked about this. First, we're going to identify shortbred and longbred, because that dictates what abortion protocol we're going to give. Prostaglandin F2 alpha given to a shortbred heifer does not have any impact on the immune system. Dexamethasone, however, given to a longbred heifer at the time of processing is immunosuppressive. So what we'll do at many times is we'll go ahead and abort the heifers that are shortbred right there at processing, but we'll put a pink dangle tag or something that's easy to identify through the lot tag of the longer bred heifers. We'll record that, and then we'll wait until that pen is through its BRD bout in the first 30-40 days, and we'll go back and we'll identify those heifers that hey, we have 5 heifers that were longbred in pen 218. We're going to go over to 218, we're going to bring them up to the hospital, and we're going to give those animals the shot of prostaglandin F2 alpha and dexamethasone. Now, I will leave those heifers there in the hospital system because I want to, within 48 to 72 hours, this isn't an immediate abortion, okay? It takes time and dilation and things to that nature. So what will happen is that I'll have our crews go in and pregnancy test or check those heifers at 48 to 72 hours to make sure they've aborted. Sometimes you'll come out and you won't see anything on the ground. That doesn't mean they haven't aborted. That may mean some sort of feral animal like a coyote came in, drug the fetus off, something of that nature. So really checking. If they haven't aborted, then we're going to give them another dose of the prostaglandin F2 alpha and dexamethasone, come back at 72 hours and do a recheck, because we want to make sure we get that taken care of. When we come back, we'll talk about some of the other options. You're watching Doctalk. We're sure glad you joined us.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idex.com/doctalk.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrosyn by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrosyn.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrosyn.
Hey folks, welcome back to Doctalk. I'm Dr. Dan Thompson, and I'm glad you joined us. I'm a veterinarian here at Production Animal Consultation and also on faculty at Iowa State University in a split appointment. And one thing I failed to mention, we're talking about bred heifers, some of the products we use, dexamethasone is not dangerous, but prostaglandin F2 alpha can be dangerous to pregnant women. And so pregnant women should not handle that product. And we should make sure that we don't store that product in the same fridge or any area that we're storing food, okay? Because it's an abortifacient in cattle, it's an abortifacient in dogs, cats, humans, anything with a corpus luteum and progesterone. So we just are really, really careful about that product and being intentional. Okay. The last option we talked about was mass aborting, or mentioned. And the reasons why we would mass abort would be that we're only going to give them prostaglandin F2 alpha, and that we're going to make sure, usually it's going to be really lightweight heifers. And so one or two of them may be bred recently, but they're light enough, and those 500 or 600 pound heifers or lighter, that we know they're not going to be 4, 5, 6 months pregnant, right? So we're going to catch nearly all the pregnancies as shortbreds. And so that's the first one. If you don't want to mass abort up front, you can wait until reimplant when those heifers are bigger and they're easier to preg check or they're easier to ultrasound, where we can come in and do it at that point in time. But really, if we can knock it out earlier in the feeding period, it's just improved feed efficiency and improved health for the heifer. Now, some of the other reasons why you might pick to mass abort is if you can't find someone to get there to do the pregnancy testing. And so you know your crews, you know the cattle, you know your veterinarian and the logistics of getting someone there, because a veterinarian has to do the pregnancy testing, because pregnancy status is a diagnosis, and almost all of our state practice acts will show that if you're going to diagnose something, you have to have a DVM. So really, when we get down to it, the number one thing we would like to do is buy guaranteed open heifers or spayed heifers. And when we start to look at some of the economics of purchasing those, or even the economics, if you're a cow-calf producer out there and you can advertise those animals as guaranteed open, it's worth some money in people that are going to buy those heifers. And so when we start to think about this and we start to think about the economics, you know, there's been upwards of $10 to $11 per head advantage economically to buying those heifers that we never have to do anything with. So long story short, 4 options that we can do. 1, we can buy guaranteed open and or spayed heifers. 2, we can work with a veterinarian to do pregnancy checking and aborting those heifers. Understand that we have short-bred and long-bred heifers, 2 different programs, 2 different reactions. Understanding that when we give dexamethasone, that can be immunosuppressive and decrease the efficacy of our vaccines, or decrease the ability of that animal to form an immune response against anything that it's exposed to during the first 30 days that it's there in the feed yard. The other one is to mass abort lightweight heifers and just give them a shot of prostaglandin F2 alpha. I'd rather preg check and abort when possible to get a better diagnosis, better accuracy, better results. When we do abort those long-bred heifers, put them up by the hospital, do rechecks to make sure that they've expelled the fetus. And all of these go into a great system of taking care of the heifers that are entrusted in our care. Thanks for watching Doctalk. Remember, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian, and I'm Dr. Dan Thompson, and I'll see you down the road.
Doctalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.